Hey everyone, this is Dr. Joyce Knieff with Yggdrasil Naturopathic Medicine, and this is a part 2 on what to do if you have an autoimmune disease and you're treating it from a functional and naturopathic lens. So in the prior video, we covered what to do if you are in a current autoimmune flare. You do have to be out of a flare in order to start treating your autoimmune disease from the root up. The first thing that I usually do, and this can be different for different autoimmune diseases. I know this is a part 2, but this could be someone else's part 3 or part 4, depending on what is manifesting in their autoimmune condition. I know I'm going to talk about the gut. And the reason why I talk about the gut in autoimmune disease all the time is because the gut is such a foundation for immune system regulation. The gut is home to the microbiome, well, the biggest home to the microbiome. You have microbiome in all areas of your body, but the gut by far is where most of your microbiome lives. And this microbiome population does a lot to modulate your immune system. It lets your immune system know what it can tolerate, what it shouldn't tolerate, what it should fight off, etc. When you are dealing with an autoimmune condition, most times, it is because of an immune system dysfunction, dysregulation, imbalance. In the immune system, and this is kind of generalizing, we have the Th1 and the Th2 arm. And these two arms are roughly in balance in a healthy system, but in an autoimmune condition, one of them can be more dominant in a way that's dysfunctional. And what the gut can do with the microbiome modulating the immune system is that it can bring these back into balance in a way that it can maintain that balance. So how do we approach autoimmune disease from a gut health perspective? Well, the first thing that you need to do is make sure that your basic digestion is intact. What does this mean? This means you're going to the bathroom every day. Yes, you're having a bowel movement every day. Yes, this means that you are having a bowel movement every day and it is complete and easy to pass. This also means that you have appropriate hunger signals, like you feel hungry, you have an appetite, you eat, you feel sated, and you do not experience any heartburn, bloating, or abdominal cramping from this. Excessive gas is also maybe a problem. So in order to regulate your immune system, first you need to regulate your gut function. And with the gut function, then you are creating a good terrain for a healthy microbiome to live in. And microbiome can get fairly complex. Depending on what you're dealing with, what type of autoimmune disease you're dealing with, balancing the gut can get a little tricky. And there are multiple different strains of microbiome out there. I know now probiotic supplements are very popular on the market right now, but not all probiotics are created the same. Different strains of microbiota do different things. And if you're dealing with a very specific inflammatory condition, then what you might want to look into is using very specific strains to control your immune system in one way or the other. There's been a lot of research recently on the different populations of microbiome and how different strains or different phyla, different big families of this type of bacteria can help shift your immune tolerance in one way or another. So if you're looking to really treat your autoimmune disease from the root up, first you have to get rid of the flare, then you have to make sure that your gut function is really solid before you can build up your healthy microbiota that can then help control your immune system to a better degree and decrease that inflammation in your life overall. A lot of this can be fairly strategic, and I know this can get fairly complex, and it changes from individual to individual. So if you're interested in working with a doctor who really understands this stuff, we are Yggdrasil Naturopathic Medicine in Minnetonka, Minnesota. We do offer free consultations so that you can talk about your individual case. Everyone is different. Every individual case is different. We can let you know what our thoughts are based on how we would approach your case and what your prognosis might be. So give us a call if you're interested. Thanks. See you next time.